We welcome in David Lam, clinical and consulting psychologist. Doing this for 45 years. Psychotherapy, stress, and wellness is your forte. Sir, welcome. Welcome to the show.
Thank you for having me, Aaron.
Thank you for joining us because this is a very requested topic. As I was saying, a lot of people want to know what can people do with, to basically treat their mental health or just to take care of their mental health while we're in this quarantine. A lot has transpired since it started from mid-March. So I guess the main things that people have asked is, and I'll throw this one out there at you as the first question, for someone that's an extroverted person, someone that likes to go out in the town a lot and social and talk and be social outside, and now they're stuck at home and they're getting what we call futless. What does that here? What does that happen? What does one do? What does he or she do? Will be the first steps.
Well, it, it's depressing, obviously, for somebody who is used to going out and doing things,
Yeah,
or whether they're extroverted or not. Actually, I mean, we have our normal daily routines where we go out, we work, we go to the gym, you go to restaurants and whatnot.
yeah,
And with the sheltering in place order, people are basically cooped up at home, and people actually in Hawaii have been very good about adhering to the guidelines, so you have to give people credit for that. And we have flattened the curve. The rate of infection has gone down. So that has been good, but it has come with quite a lot of mental health or psychological impacts. And that is true for a lot of people. In fact, in this morning's Washington Post, one of the headlines was that the pandemic is causing a mental health crisis in America. Now, they're talking about nationwide, but this applies to Hawaii also.
yeah,
In Hawaii, the irony is, on the one hand, we are among the best, if not the best in the country for keeping the infections down. I think we have the lowest rate of infection in the whole country,
right,
because people have been following the guidelines, and that's great. But on the other hand, we have the highest unemployment rate in the country.
right,
And so the economic impact of this has been just tremendous. And that has caused a lot of people to be stressing out. And this is really a very normal reaction to an abnormal situation.
right,
So, so that's a roundabout answer to your question. But I think for anybody, who's used to a normal routine and going to work and doing things, traveling and whatnot,
right.
now they are basically cooped up and locked down and shut out, so to speak. And it's promoting a lot of negative emotions.
Right. And you're saying that in the paper today that it's becoming a mental crisis. What are the signs or what are the things that I guess the U.S. is seeing,
Well,
trading?
yeah, I think three of the most common reactions to stress in a situation like this are anxiety,
Yeah,
anger, and depression. Okay, those are sort of the big three, so to speak, the three negative emotions that come about the most often when we have circumstances like what we have today. Anxiety, because anxiety is usually a reaction to loss of control.
right,
Right now, we're feeling that we have a lack of control over a lot of things. When is this going to end? Am I going to catch the virus? Am I going to lose my job? A lot of people have already lost their job.
yeah,
Am I going to have enough money to make ends meet? So there's a lot of anxiety and worry going on. The second emotion is anger.
yeah,
And a lot of people are really very frustrated and downright angry about this whole situation, because anger is a reaction to unfairness or injustice. We usually get angry when something happens to us that was not our fault. And this is happening to us. We've done nothing to deserve it,
right,
that whole pandemic.
That's true.
And so people are angry, and when they're angry, they tend to act out or lash out verbally or behaviorally, and sometimes with negative consequences. We've all done it at one time or another,
Of course.
and one of the more common therapies nowadays that are being seen in counseling sessions is anger management. That
Oh yeah.
people are very angry even before this
Yeah.
coronavirus happened,
Let's
right?
put it before this happened. Lot of guys, anger management was a thing. What can one person do then when they have this anxiety? Because it's a lot of people that when they I guess when they have anxiety, they put the blame on themselves. They put the self blame to them, but it's not really their fault. I mean, this is a thing that's out of everyone's control here. Uh, what can someone do in a therapeutic way when they're stuck at home?
That's right. The short answer to that is that they really should seek professional help.
Yeah.
Okay, and that depends on the severity of the feelings that they have. Okay, but let me circle back to that in a minute and just mention a third negative emotion that I haven't mentioned yet,
Oh
which
yeah.
is depression. Okay, and depression, as we know, is very common. Okay, and again, even before the pandemic, it's estimated that up to 20% of the general population are depressed clinically to varying degrees. And depression is usually a reaction to loss. And with the pandemic, we have lost a lot of things. We've lost our freedom. A lot of people are protesting about that. We've lost our jobs. We've lost a sense of normalcy. We've just lost a lot of things, and that causes people to be depressed. So when people have feelings of anxiety or anger or depression, um, the depending on how severe the symptoms are, okay, and we can talk a little bit more about that. But I think the first thing to think about is to seek professional help.
Yeah.
If the symptoms are severe, meaning they actually are affecting us in terms of our relationships, our ability to work, our quality of life, and it's not just for one day or two, but it lasts a week or longer, then it would be appropriate to seek professional help. And
Right.
all health plans in Hawaii have a behavioral health component. And so the thing to do that I would recommend for viewers is to contact your own health plan, okay, whether it's HMSA or Kaiser or one of the other plans, and find out what is and isn't covered. And as I said, all health plans cover a behavioral health, which means a counseling component.
Right.
Okay. And some authorized sessions, in one calendar year for, let's say, 8 sessions. Some have 12 sessions, some have 24. And each health plan is different. And the copay is sometimes different. Sometimes there's no copay, and sometimes there's 10% or 20%. But these are questions that a person's health plan would be able to answer.
Right.
And that would be the thing to do. Now, in seeking professional help, usually we think of, a person and a counselor sitting down, one-on-one, in an actual office.
Yeah.
But nowadays, because of the social distancing guideline,
I was just gonna mention. Right.
yeah, telehealth or telemedicine has become very popular, right? Whether for physical illnesses or mental issues, you could call and find a provider and have a so-called virtual visit. Okay,
Right.
that means you
Much
can
like
talk on the phone, or you could use Zoom as we are doing, or Skype or FaceTime, some combination of audio and video technology, and have a visit that way. So that has become very popular and very safe. So
right.
that's something I certainly would encourage viewers to look into.
Right. You bring up a great point. It's in essence easier now to seek counseling, to seek someone to talk to because you don't have to leave your home now. Where
Right?
people are going to use that excuse and be like, I don't want to go and meet someone in person, especially during this pandemic. I'm not going to leave the house. I'm not supposed to leave the house. What we're doing now is an excellent, which I hope will help this crisis that you brought up that's happening. As of today, you brought this article came to attention. So hopefully that's
That's,
one of the ways.
that's right. It's a lot more convenient and a lot safer, for people just to be able to have these visits just from the comfort of their own home.
Right. Exactly. Uh,
Mhm.
are you still practicing now, or you are what are you working still yet right now during this whole situation, or is it in a different capacity? Who are you seeing? Anything like?
Right.
Is it
Yeah,
busy for you? Like a lot of people calling you up. I mean,
well,
I should be
some people
calling up.
suggested it. It's yeah. When you first introduced me, you mentioned 45 years of professional experience, which is true, which kind of makes me pretty old. So I actually have retired
Right.
from clinical practice. Okay, although people have suggested that just like the Lucy character in Peanuts, and just put the doctor is in, and to retire. But no, I am retired from clinical practice. But there are lots of resources out there, and again, all the health plans, have provider panels that are connected to them, psychologists, psychiatrists,
Yeah.
so, yeah, primary care physicians, and
Right.
also licensed mental health counselors, licensed clinical social workers, advanced practice nurses,
Right.
many other counselors who can provide counseling.
Oh,
The
great.
main thing is to make sure that the provider you see is certified and licensed, certified or licensed in their respective specialty. So that's a very important quality check that you can
Big
make.
point. Yes. Very good. Well, I'm a firm believer in, David, as you know, I like to talk. So I'm a firm believer in conversation, and firm believer that we all should talk to someone. We all should go and talk to a neutral party, vent, what have you. I guess getting back to anxiety, and let's go and tackle anxiety in regards to money and financial, which I'm sure is probably the number one topic on people's minds during all of this. Everyone's unemployed. They're waiting for an unemployment check that's not coming. They can't log in. Stimulus checks. What can someone go through like generally to be able to deal with that?
Well, yeah, I mean, in addition to seeking professional help, I think there are quote unquote home remedies that people can do to help them cope with this current situation. Sort of things that you can do to boost your resilience, your coping ability. Okay, and I think one of the things is to make sure that you have some structure in your daily routine.
Yeah.
Okay? I always recommend to people to set a schedule for each day. When we're sheltering at home, it's common for people just to have one day kind of blend into the next, and it becomes a blur. You kind of, at the end of the day, kind of forgot what you have done that day,
Right.
and don't feel productive, and
Yeah.
one leads to another. So one way of counteracting that, well, yeah, I think we all are probably guilty of that,
Right.
it's to set a schedule for each day. It can be relatively the same schedule from day to day, or you could vary it from day to day. But the main thing is to have some structure. And within that structure, again, one thing that, again, you and I have talked about, and by the way, you give me advice on fitness because you're my trainer, okay?
Well,
I just want to clarify that you're not my mental health client, okay? Since you mentioned that we talk, okay? But anyway, it's to build in fitness routines, and we can just work out at home, or if we have a yard, or we could just go outside and stay close to home, just build in some kind of workout routine, because physical exercise, as you know, has been well documented to reduce stress
that is
and to
correct.
make us not only healthier physically, but also mentally.
Right.
And so exercise, whether you're doing some cardio, doing stretching, doing balance, stability exercises,
Oh,
doing weight
definitely.
training,
Right.
yeah, and you don't need a whole lot, right? I mean, you could do push-ups, you could do sit-ups, you could do
Right.
bodyweight squats, all the things that you've taught me to do, and you don't need a lot of props. You don't need all the equipment at
No,
a
you
gym.
don't. You do stuff
Yeah,
around the house. Stuff around the house, and that's it. And just staying active, and then keeping the mind and reducing stress. Keeping the mind active, reducing stress. That's really the cure of a lot of things. Uh, if we go down the line, health internally, mentally. Uh,
that's right. That's right. And the other thing about sheltering in place is that a lot of people are feeling isolated,
yeah.
especially older folks, and but the thing there is that even though we may not be able to see our friends or relatives or other family members as often as we might like, we should do, what Stanford psychologists call distant socializing. So while we are socially distancing, we should do distant socializing. And what that means, it
That's
is,
good.
yeah,
I'm
it's
tired
just,
of social distancing, David. So good that we reversed it. That's nice.
I mean, it's just getting in touch with people, either by email, by phone, by text, by
Right.
Zoom, by Skype, FaceTime, any number of ways. It's very important to keep in touch with people we care about. And that also helps us, to maintain our mental health and our stability,
Yeah.
because we don't feel isolated and withdrawn, and that can be a vicious cycle. So that is also really important.
Right. I guess I'll go into this topic because I am one of them. In regards to married people, and we've seen an uptick over the past several weeks, I guess. It may not be married people or boyfriends, girlfriends, what have you. Rise of domestic violence cases. Now, I guess we could clearly look at it logically like it's two people stuck at home all day, leading to arguing, leading to, God forbid, serious arguing. Uh, what can someone do? What can a couple do to cope with them seeing each other all day, every day?
Yeah.
How
Yeah.
can that be, I guess, generally regulated?
That's true. I mean, that certainly can be an issue, and sometimes not only a married couple, but kids, right? Now that
Yeah.
schools are closed, now the kids are home, right? And then they could be
Right.
running around making a lot of noise. So there is a lot more stress in the household. I would say, as a general rule, let's say for a couple, to give each other some kind of give each other space, okay?
Yeah.
So that it's good to do things together. And I think the couples that seem to be managing well in situations like this are those that are finding time to spend quality time together, but not necessarily spending all day together.
Oh, no.
So yeah, so you could maybe watch a movie together,
Right.
or have a conversation at the dinner table in an unhurried way, which many people before the pandemic did not have a chance to do. It's always in a rush, right?
True. Yes.
We kind of have lost the art of conversation. So
Yes.
you can sort of do that, but at the same time, give each other space, right? So that if one person is working out, the other person might be catching up on the news or reading, okay, or cooking, okay,
Right.
or learning a new language, or
Right.
doing whatever. I mean, there are many things that we can, again, build into our daily routine that we normally don't have time for.
Yes.
In my own case, for example, I mean, there are books that I have been meaning to read that I put down, but now I have time to pick them up again. I don't always finish them, but I am able to pick them up.
Right.
People are learning a new language.
Right.
Baking has become a very
Oh,
popular pastime. You hear of people
remind me.
hoarding toilet paper. Supermarkets now are running out of flour because
I've
people
seen that.
and they I don't know, hoarding or not, but buying up all the flour.
Yep.
So there are new skills that one can do, and you can do them together if it makes sense, or you could do them separately.
Yeah.
If you
Right.
have children at home, you can maybe divide up the childcare duties, so that it doesn't have to be both members of the couple looking after the kids. It could be one and then the other. I mean, you
Right.
have to find some kind of
Get a team.
division of labor.
Yeah.
But you're right. I mean, it does make for a stressful situation. And I think, again, each person needs to just find creative, ingenious ways of handling it that we may not have thought of before, And the silver lining to that, Aaron, is that if we're able to do that, then moving forward into the future, we are much better off. So we're better able to cope with situations in the future. If something like this happens again, and it very well might, in one form or another,
Right.
where we are sheltering in place or have to be cooped up or whatever, then we've been through it, and so we've learned new skills. So we see it as a challenge, and that we can learn new skills and cope with it. So in the future, if something happens again like this, we can deal with it better.
Right. Because, I mean, this is unprecedented. This has never happened before. This has never happened where all of us are pretty much on the same, regardless of wealth, race, whatever. We're all in the same thing. We're all at home. We've suffered some type of loss, uh, which is it's never happened. So we have to look at the positives of this. And like you said, we have this time now because everyone's always busy. We're always running around and we claim that we're busy. Now we are not. Time to learn something. Time to evolve as a person. Time to grow as a person. Very
Exactly.
happy. Yeah, very
That's
100%
right.
believe it.
Yeah, never happened before in the whole world,
Yeah.
right? And it's encouraging to see that at least in some respects the world is coming together. Doing some collaboration in terms of trying to find a vaccine, trying to test different kinds of treatment,
Right.
sharing data, from country to country. I mean, there's still a lot of rivalry going on, but for the most part, the world is coming together. At least one would like to think so, in a way that, one old joke, is that the only way for the world to come together is if we got invaded by aliens, right?
Well,
Well, no, we're not getting invaded from outer space, but we are getting invaded by an alien of a
right.
different type, which is a virus that has never before
Correct.
existed. You
Right.
know, so
So
there's a time to come together. It is now.
right, and I see that, and so this was the thing that I wanted to, as we're almost out of time, I wanted to share this with you because this was a feeling I had about last week, where we all know where everybody is for the first time ever because everybody's busy, everybody's somewhere, everybody's traveling, everybody's not at home. This is the first time where we all can say, "Oh, do you know where so and so is? Oh, he or she's probably at home. She's
Mhm.
probably at home." And it's an unusual feeling where it's a feeling of virtual togetherness where we are
Mhm.
all not in person together, but we are all knowing where we are for the first time ever. It's an odd feeling, like when
Mhm.
this finally ends and we all disperse and we're all back to our regular lives. It's kind of in a way sad to me because now we're like no longer together. You know where I'm getting at? Where like I know where you are right now, you know where I am right now, and we
Mhm.
can name five other friends of ours that are at home
Yeah, we're on the same boat.
on the same boat, right? Granted, we all have our own issues with things, but we're all on the same boat. And in a way, it's kind of a sad thing I look at in a little bit of way when this finally becomes back to normalcy. We're going to be separate, going on our separate ways again. That's just a little
Yeah, and that could happen unless,
right,
again, we rise to the challenge during this period and we learn things, not only about coping, but at a deeper level about ourselves
yeah,
that help us, moving forward into the future. So
right,
that even when we start getting back to normal, whatever that is, and going our separate ways, that we will not forget, that we've had this connection in a
right,
way we have now, being in the same boat, so to speak, and hopefully be maybe a little sadder, but a little wiser for it as we come out of this.
right. Because that's the one thing I noticed that I personally have made connections with people that I didn't really have as close connection with before everything, but now I am because they are readily available to converse with. Those kind of factors. It's even when I do this daily show, it's very easy to find people to want to be on the show with me because I know and they know we are both at home and we are both bored. So it's easy to kind of, you know what I mean. So it's an interesting situation, and
Mhm.
it'll just be interesting to see how we grow from friendships and relationships from now to moving forward to the new world, I
Yeah.
guess. So there's
Mhm.
that.
Yeah, that's true, and I would just add to that and say that, I mean, just as the frontline healthcare workers really are heroes right now by putting themselves at risk and treating people, not just here, but all over the country, there are things that we can also do and that people are doing, which again bring out the best of us, brings out the angels in us, so to speak, like helping elderly neighbors buy groceries or run errands,
Right.
or donating, face masks that we're making, things like that. I mean, there's just no shortage of ways that we can really bring the better part of ourselves to be helpful to others.
Yeah.
And again, hopefully that's something that we will carry with us in the future.
Right. Definitely. And anything you wanna leave us with out there for someone that I mean, granted things are getting better now with the curve flattening and whatnot, but Any last thoughts you want to give to any of us as far as like a hang in there kind of a thing to look forward to?
Yeah, that we have to hang in there. And as far as the psychological impact of this pandemic, I think realistically, we should expect the impact to last for a while. The studies that have begun to be done and the research seems to show that even though the health part, the health risks and the problems might start to recede, especially when we start getting treatments and vaccines, and the economic part, once the country is able to open up again in a safe way, that the economy might start to turn up again. The psychological part might stay with us for a while. And because I think some people really have been, in some ways, traumatized by this set of circumstances that, again, as we've talked about, we have never seen before. Okay, and so it's wise to keep that in mind. So not to expect it when things get back to relatively normal that everybody will be okay again. Okay, that there are people who will still suffer some kind of anxiety or depression or anger or other psychological symptoms. And again, the best thing to do is to contact your healthcare provider and your health plan, find out what is covered, seek counseling. There's nothing shameful about that.
Not at all.
What we're going through now is really very normal reactions to an abnormal situation.
Right.
And so I would encourage people to keep that in mind, and to seek help where they need it.
No, definitely. That's the thing. I guess it's always been the stereotype throughout the years for getting counseling or going to therapy is people just don't want to be shamed, right? But it's really it's something that everyone needs to take advantage of. Is talking to that neutral party. We always like to talk to our friends only or talk to our significant other for advice. And it's going to go a certain angle if we go and talk to these said people. So I think it's to get a fresh idea, fresh mindset, to be able to talk with someone such as yourself to get a different perspective that we're not going to get. And big fan, I guess, to say.
Absolutely, yeah. And it's not at all a weakness. In fact, it is a strength to seek help when you need it. Just as you would not hesitate, seeking help, medical help, for some kind of physical ailment.
Exactly.
Should not be ashamed or hesitate seeking help for some kind of psychological issue.
Right. Yeah. And I think now is the best time as ever because it's easier, like we said, to summarize. Virtual is just so much easier for the person. Convenience. People love convenience. So this is it. And yeah, this is good stuff. We got like 2 minutes left in the chat, so before they boot us off, David, I just want to say thank you. Thank you for taking the time out to talk with me about this. This is a topic that needs to be discussed, and I don't see much of it, but it's a big one. And I'm going to put this up on the YouTube. And thank you, everyone, to join. Stay safe out there, sir. Hopefully, I will see you in person soon. Hopefully.
Well, please do the same. And thank you for having me. And it's been a pleasure joining you, Aaron.